It's not a supply issue. In the United States, let's take that as an example. Only 1 in 6 people who are eligible for the booster have gotten the booster. Part of it was rollout and getting appointments, but now it's becoming more and more easy to get that third shot if you got 2 shots up front. So a lot of it is confusion. It's the psychology around boosters. In some cases, it's hesitancy. There's still 30% of the country has not even gotten 1 shot of the vaccine. When you talk about what's happening in South Africa, 30% of that country has received their initial series. And they don't have supply issues either. They have a hesitancy problem, as do many other countries across the world. So we have to talk about setting clear expectations. If you want that third shot in countries that have plenty of supply, turns out a lot of people are just not getting that third shot right now. So a lot of it's about clear expectations, setting clear guidance, because now the way these headlines are coming through, it is suggesting to some, the way they're interpreting it, that the vaccines aren't working. And we have to be really clear that they are. They're just intended to keep folks out of the hospital.
Yeah, where does that leave the story with therapeutics, the COVID pill essentially? And how much of that would be effective in this sort of an environment? If you're unvaccinated, you get Omicron, and obviously you're fighting the disease.
Well, it's an enormously powerful tool, and we just don't have enough of it. So that's the reverse problem with the vaccines. We just don't have enough of that pill from, say, for example, Pfizer, which is developing a really effective, they've already developed it, they're seeking regulatory approval across the world. This oral pill is incredibly effective at reducing the risk of hospitalization for those that are high risk, that come down with a diagnosis and they receive it early after the onset of symptoms. Problem here is we just don't have enough supply to really make a dent on those that are expected to die from this virus in the next 3 to 4 months. Distribution is going to be an issue. Equitable distribution is going to be the big issue. But up front, in these first few weeks, it's supply.